So this presentation, it's interesting. I've given this presentation at various times during the COVID pandemic, and I've kept some of the earlier slides in there just to give us a little bit of a glimpse back into the past. And I think we all feel like we're a little bit more jaded and calloused than we were back in 2020 when all this was coming along. So I look back on some of these slides and see what the perspective is. But I'll share some of the lessons that we learned, and I'll speak both as a nuclear medicine physician and also as a chair of a radiology department, looking at things as from more of a programmatic perspective. So, not news to anybody at this point, SARS-CoV-2 novel coronavirus, first identified in Wuhan, China in December of 2019. There still is probably a little bit of debate on how exactly it's transmissible, but I think it's leaning more towards being aerosolized rather than droplet transmission at this point. And interestingly, the RT value that we all pretty closely follow these days is quite high, initially estimated for the original coronavirus at 5.7, and some of the subsequent variants may be even higher than that. Rapid spread globally, became a global pandemic, and it was declared in March 11th of 2020. Which in some ways seems like it was just yesterday, but again, we've all gone through a lot since then. This was a slide that I had in one of my earlier presentations, and this is the data as of October of 2020. So we're already several months into the pandemic at that point. If you just look at the lower left-hand corner, the number of deaths at that point worldwide, about 1 million deaths in October of 2020, about 33 million cases diagnosed. I pulled this recently from that same WHO website, and you can see the number of cases has gone up to 396, almost 400 million cases worldwide, and the deaths went from 1 million up to over 5 million, almost 6 million deaths worldwide. So even though the number, the pictures on the graph, the color on the graph don't look that much different, obviously we saw a large spread of coronavirus during that time. The symptoms we're all familiar with: cough, fever, shortness of breath, loss of smell, GI symptoms. The worry is that in the long run, or in certain select patients, it can result in SARS, in acute respiratory stress, respiratory syndrome, and actually result in severe illness and hospitalization, ICU, and possibly death. The imaging findings were very interesting when they were first being discovered, very characteristic of SARS. And coronavirus, ground glass opacities, they tended to be very nodular in configuration, peripheral in distribution, with areas of superimposed consolidation. And that was first published in the RSNA journals and online with an article entitled Spectrum of Imaging Findings for Coronavirus, SARS coronavirus. So I live in Houston, Texas, which is currently the 4th largest city in the United States. When you look at the overall numbers in the US, the LA County area generally has the highest number of coronavirus cases. Maybe the Chicago area somewhat under that, but Houston is right up there. And certainly in the total number of cases, Houston is on par with New York City in the number of cases we saw over time. So looking back in time, we were flying along. This is our healthcare system. Things were going pretty normally. And I say this with a little bit of humility, and I'll come back to that concept in a little bit. But this is what we started seeing in the first time when COVID cases were starting to crop up in the Houston area. This is what we saw our cases doing. And if you look again at that bottom, this is in January to March of 2020. So in the very early days of the COVID-19 pandemic, we started to see the number of cases go up. And obviously that triggered some fairly rapid responses, and this was occurring nationwide. Our worry was that this would continue to increase at a geometric pace.